Monique, thank you for being open and honest with me.
Yes.
But I can tell you, I am not trying to use you as a guinea pig.
Excuse me. What do you think could have brought it to that level?
Yeah, that's a very good question, Miss Monique. So I wanted to talk to you about that today. I would like to start you on a blood pressure medication. Is that something you'd be agreeable to?
No.
Oh, okay. You're very adamant about the no. Why not? Hi guys, it's your girl Lady on PC here, back again with another educational, motivational and inspiring video. Welcome to the Medical Dots. In this channel, we bring clarity to medicine, one dot at a time. And just a disclaimer out there, I am not your doctor. I am not a doctor yet. I am just a medical student who is passionate about teaching members of the public about the things I learned in medical school. So I'm hoping my channel will be a source of reliable healthcare or medical information for you. All right.
Taking care of your health is your priority, and how you feel is your own responsibility. Usipoziba ufa, utachanga ukuta. So understanding the why behind the medical advice, connecting the medical dots, connecting the medical dots, the medical dots.
Yes, doctor.
Can I come in?
Come in, doctor.
Hi, how are you, Queen Monique?
Good morning, doctor.
Good morning. How you doing?
I'm good.
It's a pleasure seeing you again.
Thank you, doctor.
How have you been?
Quite good.
Yeah?
Yes.
I see. I have been getting reports from your personal trainer.
Yes.
He tells me you're doing excellently well.
Thank you. Yeah, he's also helping me.
Okay.
Yes.
I haven't told you, but I'm very impressed by how you take charge of your health.
Thank you.
Because given that you're 70 years old,
Yes.
you're one of the healthiest patients I see in my clinic.
Thank you.
So I wanted to tell you that you're doing a good job.
Thank you.
Yeah. And so everything okay otherwise?
Yeah, I think so. Yes.
So today you're here for your regular checkup, correct?
Yes, doctor.
Besides your blood pressure, is there anything else that has been concerning you since I last saw you 3 months ago?
Since I left here, it has just been okay though, with some slight headaches.
How often do you get the headaches? Or when? In the morning, in the evening?
Most likely in the evening.
In the evening?
Yes.
Okay.
Yes.
I'm sorry about that. Have you experienced any other symptoms? Or is there any other thing that's bothering you?
Not at the moment.
Okay.
Yes.
Yeah.
Yeah.
Okay. It's good that you came. I'm glad you did your blood work yesterday. As usual, everything looks perfectly fine.
Thank you, doctor.
Yeah.
Yes.
So with the headache,
Yes.
what it tells me and what I'm seeing today, the only thing that's concerning me today is your blood pressure is still high.
Oh.
Yeah.
You mean it?
Yeah. So the nurse took your blood pressure and the systolic number, the top number is 175 and the bottom number is 110. So one of the ways we can manage blood pressure is through regular exercise and eating healthy.
But that is what I've been doing, doctor.
Yes.
Yes.
Yeah.
I do it in the morning and in the evening.
Exactly.
And since I left this place, I've been checking on my diet. Yeah, I don't just take anything I get on the way
Yeah.
or on the table.
Yeah.
I'm always accurate
I know.
and very sensitive about my diet.
That's true.
Yes.
Have you also been taking blood pressure measurements at home?
No, that one I don't want to cheat you.
You don't want to
Because
take?
I did not know that I have blood pressure.
Yeah, sometimes when you're just seeing a doctor or in a healthcare setting, your blood pressure goes high. But yours has been a little bit on the higher side consistently, right?
Excuse me. What do you think could have brought it to that level?
Yeah, that's a very good question, Miss Monique. So given that overall your health is okay, your kidney function is perfect, your cholesterol is okay, this is what in medicine we call it idiopathic. So with that, then I'll give you a diagnosis called essential hypertension. It just means it's blood pressure that is chronically, like it's always elevated, but I cannot explain why. Okay. So we have different things that can cause blood pressure. Are you interested to know about this, or?
Of course, I would like to know and how to go about it.
Okay.
Because I've been checking on my blood. I've been checking on my diet. I've been doing the exercises each morning, evening, and I feel I'm good.
Yeah. No, and you look good. And like I said, reports from your personal trainer says you've been doing good. So it's just sometimes because of age as well, because you're also like 70 years old, you're not young. So after some time, your blood vessels don't work as well as a younger person's blood vessel, and that can lead to blood pressure, to elevated blood pressure. Okay. Some of the things that cause blood pressure is kidney disease. Now your blood work shows your kidney function is perfect, so I rolled that one down. Other things that can cause blood pressure is we can have certain types of tumors or cancers that can produce hormones like adrenaline, and then adrenaline can lead to high blood pressure. With that, if it's a cancer, you could have other symptoms as well, not just blood pressure. So I'm less inclined to do further tests to check for the tumor. But if you want to, I can order a CT scan, just an X-ray imaging of your kidneys to see if there's anything. I don't think it's something you need to do that now, to be honest, because you would have had other symptoms as well. Your heart rate would be high, you'd be sweating, you know, and I don't see that. So I don't think you have a tumor that's secreting a hormone that could lead to high blood pressure. And other things would be lifestyle, like if you eat fatty foods, you have diabetes, you smoke. So those things can overwork your body, and in turn, your blood pressure can be high. That's my differential diagnosis, and ruling down everything, that's why I've come up with a diagnosis of essential hypertension for you. Does that make sense?
Well, I think so, but I don't think I could have been having blood pressure as at this early. To me, 70 years, I'm still very young.
Yes, and you look young. You look young. Yes, ma'am.
So for that matter, what is your advice?
So I wanted to talk to you about that today. I would like to start you on a blood pressure medication because you have been exercising and eating healthy, but your blood pressure is still high. So I think we have come to that point where we need a little help from medications that can lower your blood pressure. Is that something you'd be agreeable to?
No.
Oh, okay. You're very adamant about the no. Why not?
Because I'm an African woman. I don't see the reason why.
Okay.
Yes.
So what do you mean that you're an African woman? Help me understand.
We are strong people. We can make it through exercise and many other things because we do a lot of work. Why should I have it?
I understand. I understand, and that's a very good point, and thanks for bringing it up. I understand you're hesitant to start taking medications, but the reason why I am, or first of all, do you know why I want to bring your blood pressure down? Do you understand why I'm concerned about your blood pressure?
Yes, I know.
Okay, why?
Just simply as I have said, that because I'm an African woman, that's why you want
you to be on medication.
Yes.
Queen Monique, thank you for being open and honest with me.
Yes.
But I can tell you, I am not trying to use you as a guinea pig or to prescribe the medication just because. I am concerned about your blood pressure because when someone's blood pressure is constantly elevated, it can lead to terrible diseases like stroke. So what happens is your blood pressure is too high, even in your brain, and it can lead to vessels like even bursting or blood clotting forming there, and then that can lead to stroke, meaning you don't get enough oxygen and nutrients to the cells in your brain, and your brain cells die, and then you lose function. That is stroke. So that is one of the things I am concerned about, because the number one risk factor for stroke is high blood pressure.
So you mean that is why you want to see my blood pressure being brought down?
Exactly. Exactly.
It will help me.
It will help you. It will prevent you. It will significantly decrease your chances of developing stroke.
Oh, doctor.
Yeah. Yeah. So, and I understand the mistrust you might have in the healthcare professional. I know with the history of the syphilis experiment and many other experiments that have been done in the healthcare, and mostly mistreating the Black community. So I understand. I understand your reservations, but I also appreciate you being honest with me.
In fact, I thought that was where your interest is. You wanted to taste on me.
No, ma'am. No, ma'am. And again, thank you for being honest. I am just concerned with your health. I have been your doctor for a long time, and I just want to make sure you live a healthier life. Okay. So the medication that I'm thinking about to start you, it's called amlodipine, and I'll start you on a very low dose. Now from there, we can see how you react to it. If your blood pressure goes down, then we can maintain that dose. If it doesn't respond, I'm afraid I might have to increase the dose a little bit, and we go from there.
It is to be taken.
Yeah, to be taken by mouth. Yes, good question. And I do have a question for you. Would you rather you take the medication in the morning and in the evening, or you'd rather take it just once a day?
Twice a day will be too much for me.
Okay.
As an African woman who does not have time.
I know you're busy going to church, taking care of your grandchildren, everybody.
I think the best one that I cannot forget is once in the evening,
Once
when I'm somehow settled.
In fact, I like that approach better, because then when you take it in the evening and you wake up in the morning, your blood pressure will not be as high in the morning. Yeah, so that's good.
Thank you.
Okay. Thanks for educating me on that and sharing. Yeah, so what questions do you have for me?
Hopefully, looking forward that you will help me. I don't want to take tablets every now and then, or be on permanent medication. I would like to have something that will help me not have it anymore.
Okay. Okay. I understand, and let me just set expectations so that we're on the same page. While I wouldn't want you to be on medication forever, sometimes some people have to be on the medication forever. I'm not saying that's your case. But we will see. We will go by the ear and see how you respond to the medication.
Okay.
Yeah.
Okay.
Like I said, we might have to increase the dose, or hopefully we don't have to, and we can transition to, like, instead of you taking it every day, you can take every other day. Okay. So we'll just see how your body responds to it. But I want to make sure we are on the same page, that you might have to take it for a long time, or we might play around with it.
Since you have convinced me and I've accepted, let's see what will happen with time.
Okay.
Yes.
Yeah. Thanks for being open.
Yeah.
And I hope it's going to be okay. Like I said, I'm so proud of you for taking charge of your health.
Okay. Thank you, doctor. Thank you for spending your time with me.
Thank you. Thank you.
You are such a doctor.
Thank you,
Thank
Queen
you
Monique. So, as you saw my interaction with Queen Monique has had consistently elevated blood pressure, but she has been reluctant to take medication for good reasons. Number one, who wants to be on medications chronically? I don't think anybody wants that. And the other reason is she was skeptical about beginning to take medication because, according to history, we know how the mistrust that certain populations, especially the Black community in America, is very skeptical about healthcare interventions. And I do understand. But during our interaction, I was able to explain to her why controlling her blood pressure is important and why starting to take medication is important. So while I am not advocating for always being on medication or taking medication, this interaction was a good demonstration of why it's important to get empowered with the right medical knowledge so that you can advocate for yourself. As you saw what Queen Monique did, she was able to advocate for herself, and instead of me prescribing a medication that she should take twice a day, I'm only going to prescribe a medication that she can take once a day. She also talked about her allergy, and so I'm not going to prescribe a medication that she's going to be allergic to. That is what I mean when I say you take charge of your health. And that's why I believe the medical dots is very important for everyone. You might not feel like you need it right now because maybe you feel healthy, but trust me, having a basic understanding of medical information or healthcare information will help you when you need it, or will help you be a good support system to your family. So, what did you think about today's video? It's a little bit different from what I've been doing in the past, but let me know what you think. Comment down below if you have any questions about blood pressure, or if you want me to talk about any other health topic that you'd be interested in. What do you have to say to Queen Monique? Let us know down below. Thank you, Mommy.
Thank you.
Don't forget to subscribe, to like this video, comment, and share this video with your friends, colleagues, and family members. Thank you guys, and may God bless you. Let us continue creating and connecting the medical dots. Fix the small problems, don't let them grow. With the medical dots, let the wisdom flow.